Doctor, I know we want to talk about the vaccine and all of the logistics behind getting it out there. But first, I do want you to take your chance to respond to what the president was saying last night about masks and about herd. He said mentality, but again, herd immunity presumably is what he meant.
We know that we have data now that masks are preventing people who don't know they're infected from spreading it. So this has become a major way that we get back to some semblance of normalcy. If people wear face coverings, they're less likely to spread it. So this is something that we need to be embracing and using and advocating, and the president needs to be setting an example. And the idea that we can get to herd immunity and not suffer horrible consequences in terms of deaths, disability, or in hospitals being overrun is really crazy to me, because this isn't a disease that only causes mild illness. It clearly can put hospitals into crisis. It's killed hundreds of thousands of Americans. It's going to kill hundreds of thousands of Americans. This isn't something we want to get herd immunity through natural infection. We want to get herd immunity through a vaccine. And those types of strategies really cannot be pursued without major amounts of death and disability that accrue.
So we heard today from Director Redfield at the CDC about a vaccine, and he was saying that it won't be until the second or third quarter of 2021 where we as a country can start to get back to normal. Let's put the vaccine on the most hopeful expedited timeline. Say there is one that gets approved in the next month. What is or maybe if you want to be more realistic at the end of the year, but let's use the most expedited version. What is the first step logistically to start getting Americans vaccinated? Who would be first? And I guess just take it away. Explain it to us.
So what will happen is you'll have priority groups set. So the ACIP, which is part of the CDC, as well as the National Academies of Medicine, will work on who is the priority group. And that's likely to be healthcare workers and high-risk individuals. So you may see the vaccine trickle out and go to those populations, maybe in the best-case scenario before the end of 2020. But when you think about vaccinating the entire country, remember, this is 2 doses that has this very complicated cold chain for many of the vaccines where you have to keep this virus very, very cold. That's going to be well into 2021 before we get enough people vaccinated to say we've crossed the herd immunity. It's going to be an enormous logistical challenge. It's really important we start preparing for this now, thinking about where people are going to get vaccinated, how we're going to keep track of people who need their second dose. All of that's going to be enormous, much bigger than the 2009 H1N1 pandemic. And it is something that we have to expect there are going to be hiccups, that there's going to be problems. We saw that during 2009 H1N1 when supply and demand were not necessarily matched. And I got vaccinated after the peak had occurred in my area for 2009 H1N1. So this is going to be very, very challenging. I think we can do it, but it's going to take a lot of coordination.
Well, hiccups might seem hopeful given our track record so far on this virus. We never got a national contact tracing system in place. Testing is still a problem across this country. Given that we haven't got a handle on either of those two things, are we going to be prepared to roll out 2 to 3 different vaccines potentially that need 2 to 3 or 1 to 2 doses for each person? How do you identify who is most at risk? How are we even going to start to figure this out?
It's going to be very challenging. What we have to do is start looking at how much vaccine we think that we're going to get, how many are going to be in each batch, and then trying to decide among the healthcare workers, which healthcare workers should get it first. Should it be places that are hotspots? Should it be high-risk individuals in the healthcare worker arena? So this is going to be something that is going to take a lot of time. It needs to have a lot of transparency. We have to get the public to trust this process. And the track record, as you said, has not been very good with any kind of national strategy for anything related to COVID-19. So there are doubts. But we are using the Department of Defense and some private companies like McKesson that have major inroads into hospitals. So that gives me a little bit more confidence. However, I do think we need to have strong leadership and a lot of transparency and a lot of public discussion about how we're going to do this, and just expect that this isn't going to be the easiest or the smoothest type of thing that we've seen.
We also have a long way to go to build back trust among the American public. Just an NBC News SurveyMonkey poll before we go. Will you and your family get a COVID or government-approved COVID-19 vaccine when it becomes widely available? Yes, 39%. No, 23%. Not sure, 36%. Those numbers are not good if you want to inoculate the entire population and get us back to normal. For now, Dr. Amesh Adalja, thank you so much for joining us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.